Hello and welcome to another episode of The Recovery Voice, where we discuss about healing, hope, and the power of recovery through rehabilitation. I am your host Ashraful Goldar, and today we are honored to have Dr. Rajan Kumar, consultant neurosurgeon at Manipal Hospitals, Mukundapur, with us. Our topic today is one that impacts thousands every year: the first 30 days after a spine injury, critical windows for rehabilitation. Dr. Kumar, welcome to the show.
Thank you. Thank you. Namaskar.
Dr. Kumar, could you please start by explaining what happens medically in the body in the first 30 days after a spine injury?
Actually, whenever injury occurs in the body, there are two mechanisms occurs. First is the primary and then is the secondary. Means whenever there is a hit to the organ, any organ, in this particular case like a spinal cord, the spinal cord injury is primary, okay? And after primary injury, there is the cycle of events started inside the spinal cord that is called secondary injury because of the inflammation, because of the bleeding, because of the trauma. So it is very important to understand the pathophysiology of the injury. So this is the main point. We cannot prevent the primary injury, but we can prevent the secondary injury because of the chemical mediators, because of the inflammatory cells in the body. So it is very important that early rehab or the early treatment of the secondary injury inside the body after primary injury.
Okay. Why is early rehabilitation within the first 30 days so crucial, Dr. Kumar?
Yeah, as I said, that the early rehabilitation is very much important because in the brain and spinal cord there is a terminology that is known as the plasticity. What happens, the neuron cells or nerve cells once got damaged, that doesn't going to recover, but the cells which are lying adjacent to the damaged cells have the capability to adapt and to take over the functions of those neurons which are got being damaged. So for the better plasticity, for the better neuronal recovery, early rehabilitation is very important, and moreover, it helps in preventing joint stiffness, pressure ulcers, and if there is any deficit or any loss in the power, locomotor physiotherapy is very much important. And this is not only kind of physiotherapy, it's a kind of rehabilitation procedure. It's all a chapter, a big chapter that includes everyone as a team. That means one physiotherapist, one speech therapist, one PMR doctor has been involved, nursing care, and everything is being involved. And that teamwork gives us a very good recovery in early phases if we start rehab.
What are some common barriers patients face in accessing early rehab, and how can they be overcome?
Yeah. For this question, I want to say that awareness in the society is very, very less. In society, still the people are thinking that post-trauma or post-treatment, physiotherapy is the only part of rehabilitation. That's not true. Physiotherapy is one of the part of rehabilitation, but physiotherapy as a sole never be a part of rehabilitation. So the awareness in the society regarding that the patient who got paraplegic or having some kind of monoparesis or weakness in the lower limbs, the patient who was walking, talking, doing everything in his daily life, now he is bedridden, he needs emotional support, psychosocial support, and they want some specialized care centers which is not like home care and not like hospital ICU or high dependency unit, but in between that, in this place, the center healthcare at home like this centers have come into the action, and this bridges the gap between the hospitals and the home care facility. So it is very important to understand that rehab centers are playing very important role in early recovery and regaining the strength of the patients.
जो भी फैमिली आज ये प्रोग्राम सुन रहा है, Can you brief on the difference between treatment at hospital and rehabilitation at specialized centers?
Yeah. As a neurosurgeon, I usually deal with all kind of strokes, head injuries and spinal injuries. Okay. So in the hospital, our main target is to save the life first. Okay, so we are dealing with acute injury that I call you the primary injury and secondary injury, and we have to treat that. So, in this kind of cases, when we save a life, when we stabilize the patient, then we need a place where patient can be shifted at a lower cost than the hospital ICU SDU, where a total holistic approach treatment can be given to the patient for better mobilization, for better psychotherapy, social therapy, emotional support. So in this time, we need a transition or a place where we can shift the patient. When they are very much stable in the hospital, they don't need ICU, they don't need ICU, but they need total support of the rehabilitation equipments, because in the hospital we don't find such equipments. We don't find a dedicated rehab unit. In fact, in most of the hospitals these things are lacking. But the center like healthcare at home, you people are having very nice all kind of equipments, gadgets, and which is very advanced with the dedicated PMR doctors that gives a sharp edge to recover the patient for their better life. They can rehabilitate into the society. What does rehabilitation means? Rehabilitation means to overcome the hurdles what they are facing. They have to regain their self-confidence and to reinstate into the society so that they can earn their own, they can support their family. If a patient got paraplegia after dorsal spine injury or something, arthrogenic injury or road traffic accident, that doesn't mean that is the end of the life. Okay, they can recover, they can come back, and they can do some job even to support their livelihood and their family. That's where HCAH like centers come into action.
What advice would you give to the families or caregivers managing their loved ones in the first month after a spine injury?
Okay, I suggest to all of my patients, whenever the acute treatment in the hospital got over and they don't need the ICU care or dedicated specialist care, I tell them don't wait now. Now the time has come to step down to to go to the center where there are the instruments, equipments are there, and this thing is not just about the survival. This thing is to rehabilitate into the society back and to regain this social support, emotional support, psychological support, to regain your locomotor function. You need to follow medical protocols strictly and create a supportive environment, and rehab is not an option. It is necessity.
Thank you, Dr. Kumar, for those valuable insights. The first month after a spine injury is not just a recovery phase, it's a race against time. To our listener, if you or someone you love is facing road to recovery, remember healing, hope and help are available centers like HCAH. Until next time, stay informed, stay strong.